Hold on, guys. I haven't done a video in a long time. Those who've been following my story, we're now running a bladder augmentation support group on Facebook, which we're quietly getting some members for. Things aren't going too well at the moment. I was dragged all the way out to Bristol. For those watching across the pond, Bristol is the nearest hospital to me that does reconstructive pelvic surgery. It's about a 4-hour drive from South Cornwall, and it meant not drinking for nearly 8 hours to get up there and nearly 8 hours to get back to avoid having to go for a pee more than once. Whilst I was up there, they were saying, yep, we're happy to proceed with surgery, but can you go away and try iAluril installations? So today we're talking about bladder installations. Now, depending on what your symptoms are, you may have a different type of bladder installation. Today I'll be focusing really on iAluril, which is a chemical solution of elements naturally found in your body to replace the gag layer in your bladder. Now, the gag layer in a normal bladder is what protects the bladder lining from all the crap and all the acid and shit that's in your urine. Obviously, in IC patients, possibilities to why you can end up with severe IC like I can is that for some reason this gag layer breaks down, causing the inflammation and obviously the scarring that's most probably left that I've been left with in my bladder. The information online for iAluril is very generic. It's not particularly accurate to your individual trust or hospital. So I'll sort of go over how my hospital does it. Online, it states you can have the first one in clinic and further ones you can do at home. At my local hospital, that's not the case. I've been dealing with Sachin Mould in London, who's an IC specialist. He said their bladder installation can be done indefinitely if beneficial. Again, my local hospital does not authorise them past 6 months. So we're going to be checking on Wednesday to see if my GP will prescribe them past 6 months. You got online, it states you only have to hold it for half an hour. My hospital says an hour if you pee normally, or 2 hours if you self-catheterise like myself. And again, what I wasn't expecting when a little information letter came through with the appointment dates was you cannot drink for 4 hours prior to a bladder installation. This is basically so you don't need a pee in the time that you're holding the installation in your bladder. If you're dealing with a normal capacity, then it's probably not such an issue. Obviously, with me, sort of thing, now I've only got 200 mils, and the bladder installations are 50 mils. So you haven't got I haven't got a lot of extra filling capacity with the installation in my bladder. I had mine at 9 o'clock, so basically I just didn't drink nothing in the morning. I had a yogurt as opposed to a bowl of breakfast cereal. I had literally a mouthful of squash to take my tablets. For me, going without drinking for hours on end is not an issue. It's just inconvenient, really. I happened to have a flare that morning. I'd done a bit of stress. I seem to be getting a lot of flares in the mornings now. I've been reluctant to up my saw palmetto in the evenings. It's basically once you're on the top end of everything, there's nothing else. So hopefully the iAluril may stop my morning flares that I've been getting. It's one of these treatments. It's a bit like Botox, a bit like meds. It appears to be only good for the time you're having the treatment. Now, iAluril is normally used to treat embedded infections, normal cystitis, or pain, none of which I get. This is why Matt Hodgson, who's my primary urologist, was very reluctant to try the iAluril installations when Professor Shim in Bristol suggested them last year. We're only doing them now at Bristol's request. They seem to think it's going to improve my capacity. It's highly remote. But some I've spoken to on the Facebook group say they can go back to drinking irritants because it gives that protection there to the bladder that obviously isn't there at the present moment in time. So we're going to, I had my first one today. So I'm just going to run through what you're going to expect, really. They were lucky they were running on time. Nurse took me down to a room. If you self-catheterise, the process is going to be a piece of piss. No. The cath they use, I think it's about an 8 French. It's quite a small cath. They tend to use my hospital just use low fructorigos, which is what I use. They're a hydrophilic cath. Obviously, I self-catheterize using instillations as well, so I took all my cathing gear with me. I wasn't particularly happy about the fact they wanted to put the cath in. Like everything, I've cathed over 7,000 times since Feb last year, and I've had, touch wood, no infections. So I'm just hoping that, no, there should be highly remote getting infection. They reckon generally going on, if you self-cath, the risk of having an infection whilst having bladder installation is no higher than if you cath generally. If you don't cath, there's always a risk of an infection. I'm only 2 weeks off my Botox, so I'm hoping and praying that I don't get an infection having somebody else cath me that I don't normally do at the end of the day. I only ever cath myself, and I'm very particular how I do it. And it must work. No, I haven't had no infections in all that time. Yeah, so I know I've seen some pictures, people's experiences on Facebook. They'll have gynae tables or whatever sort of thing. I don't know what they'll do for women. No, for blokes, because everything's easy accessible. They just had me drop my trousers, lie back on a table. You got a pad there, so there's really no risk of leaking. I did all the prep, so I got me out. Got out my baby wipes. I mean, instead of gel, putting a little bit extra because again, I'm not putting the cath in this time. Somebody else is. So I'd rather have a bit more lube there than what I might necessarily put in myself. Again, 8 French cath. End of the day, it's a very small cath. No, it's obviously not as fine as as a little sensor catheters they use for urodynamics, but he ain't no flexi scope at the end of the day. If you're not used to having their if you don't normally self-catheterize, you might find there's a bit of bladder irritation. Like end of the day, I cath anywhere between 8 this time of year, 8, 10, 11, 12 times a day. So my body's so used to catheters now. I'm not going to get any irritation from it. So the nurse passed the catheter in. She drained my bladder. I hadn't been for a pee since I left home. Normally, if you can pee normally, they'll normally ask you to empty your bladder prior to coming into the room. So then all they're draining is residue. Obviously on me, she drained quite a bit. Usual 200 mils, because I hadn't been for a pee. And the problem is, if you go for a pee too close to your appointment, they don't really know. They don't know for sure. If there's no residue there, they don't really know for sure how far the cath got in unless you self-catheterize. No, I know how far the cath normally goes into me, how much is left, and even if there hadn't been a lot left in my bladder, I would have known at what point the catheter was in there. Again, on the iAluril website, they offer iAluril adapter, which basically connects to the 50ml syringes. These are more designed really at female anatomy. They do show them on the iAluril website being used for male anatomy. The only problem with male anatomy is you've got to pinch the tip of the shaft off once the syringe is empty. You then got to draw 20 to 30 mils of air into the syringe to push the remainder of the iAluril into the bladder. It's not ideal forcing air into your bladder. Obviously, I know those that have watched my previous videos know that I'm quite well endowed. So obviously, I've got a much longer urethra than an average male. So the iAluril adapter for me would just be a waste of time. No, I'm not going to start shoving 30 or 40 mils of air into my bladder. No, it's not going to come to any. I suppose if you pee normally, it's not going to come to any harm. The air will work itself out, but it's not something you really want to be doing. So, to all intents and purposes, so if you're offered the iAluril adapter, now if there's any men that have used the iAluril adapter, by all means, drop a comment. Now, if you had a good experience with it, on the iAluril website, they show it being used on males with adapter and with a catheter. The iAluril itself is quite thick. It's probably thicker than Instillagel. Those that use Instillagel, it's not water at the end of the day. It is quite thick. So you will get a bit of residue. I think that's why they like to use a small cath, because obviously the smaller the cath, the less the residue is going to be left in the catheter, really, because you want as much of that 50ml going into the bladder as possible. And again, it's sort of not a quick panic. It's not going to suddenly shoot out urethra when you pull the catheter out. It might drag a bit behind, but like what my caths do when I'm cathing, there's always residual urine there. But I didn't notice it was dragging a lot out. No, at all. No. It's a similar setup. If you were having the Foley, so there's a pad put underneath your tackle. There's a bit of sterile drape dropped over the top. What I don't like, if there's any urology nurses that watch these videos, I'd like to drop a comment. There's a there's anti-touch collar on these intermittent casts, and the urology nurses will not use them. I don't know why they won't use them, but they won't use them. The whole idea on these intermittent casts, especially the low frickorigos that have got the releasable anti-touch collar on them, is that the whole idea you do not touch the catheter. So at the end of the day, there's a pair of gloves out of a packet, there's a piece of sterile cloth out of a packet, but you're still touching the catheter. The whole idea of these non-touch collars is that you do not touch the catheter. Now, what I do in mine when I withdraw them, after activating the packet, open the packet, pinch their anti-slip collar with my left hand. I'm right-handed, but I cast with my left hand. I don't quite know, but I do quite a lot of things with my left hand, like hold a glass and hold a mug. No, I suppose class myself as semi-ambidextrous. And I pull half the catheter through that collar before removing it from the packet, which gives you a lot of control, because they'll sort of teach you to draw it all from the packet and then slide the collar down. There's so much risk then of it touching something, and that's when you're going to get an infection. So I don't know why they insist on doing it like they do. They claim it's all sterile, and I suppose to all intents and purposes in the male bladder, when you're long urethra, if they're only touching the middle of the cath, the likelihood of any bacteria getting up into your bladder is remote. But I don't like the way they do it. I don't quite know why they do it. So is there any urology nurses watching who'd like to explain why you do it like that? And I'll be more than happy to receive that in the comments. And I think the whole process was over in about, 10 or 15 minutes. Now, again, I was told on the phone when I spoke to my urology clinic about what to expect, really. Oh, you have to sit in the clinic for 2 hours afterwards to make sure it stays in your bladder. I was told I could go straight away. Like I said, end of the day, if you pee normally, you ask to be kept in for maybe half an hour, maybe an hour at tops. If you self-catheterize, you'll be asked to keep it in for 2 hours. And I found I had to drive 15, 20 minutes from hospital to site, and I managed to keep it in my bladder for 2 hours afterwards, sort of thing. I needed a pee. I was not quite busting, but I was needing a pee at that point. And to be honest, it didn't seem to be, the urine didn't seem to be any thicker or thinner than what it would have normally been if I hadn't had the iAluril installation. If you worry, guys, if you've not had installation before, the nurses don't give a shit at the end of the day. They're all very good. They do this day in, day out. So unless you're hung like sugar, there's nothing they are gonna have seen before. Obviously, if you're not packing a lot in the trouser department, then obviously cathing you is going to be a little bit more awkward than somebody like me who's packing quite a lot. Either way, lying on the bed doesn't do you any justice, sort of thing. Everything flops back. No, we all know sort of standing up, everything hangs away and everything looks more impressive standing up. Just generally going on, I just self-cast standing up. So when I went up and I've had to cath in hospital, when I go in for Botox, it's never easy cathing in bed. No, I prefer to stand up. No, stand over a toilet. No, if you're a bloke and you can't sit down, then fine. Whatever suits you. I've only ever done it standing up, and I find it more convenient standing up. It's just a pain with these installations. That my local hospital don't offer them past 6 months. Generally going on, you have one a week for a month. Some hospitals stretch this to one a week for 8 weeks. I think it's what Bristol suggested. Some do one a week for a month, one every 2 weeks for a month, and then one a month for 4 months after. Traditionally, one a week for a month, and then one a month for 5 months after, by which point it deemed whatever problem you had that it's treating is going to have been sorted out. But I'm going to have to speak to my GP on Wednesday to see if they will prescribe them past 6 months, because otherwise it's going to be a short-lived. If it makes an improvement, allows me to go back drinking irritants in moderation, it'll be a short-lived improvement if I can't get it past 6 months, at which point I may not bother doing, I may not bother pursuing it much past January, which will be the first maintenance. It's going to be, remains to be seen really whether, obviously having them once a week be one thing, having them once a month is something else. So I might find there's a benefit, or you might find there's a benefit having them every week, but then you don't find there's a benefit having them every month. So it's going to be a bit of trial and error really as to obviously if you have different solutions. They always tend, I think most bladder installations are 50 mils, so whether you're having iAluril, whether you're having DMSO, it's all going to be about the same kind of setup. No, different solutions are going to have different side effects. The iAluril shouldn't really irritate, because they're supposed to replace what's naturally found in your body, like the DMSO treatment is obviously made up of other chemicals and such like, which could irritate the bladder. Now they say you can get urgency frequency for 2 days afterwards, risk of blood, all this from catheter sort of thing. So at the end of the day, because I sell catheterized, no, if you sell catheterized, there's nothing to worry about really. No, end of the day is if you're used to using 14 or 16s, well, 8 is going to glide in like butter. No, so I'm used to using the 12 sort of thing, and it was a little bit. You could sort of feel it snaking up through, but there was no, certainly wasn't like when I had a scope. That did hurt. That did, like, no. So hopefully that will give a little bit more reassurance for anyone who's having installations, what to expect. So obviously a female, it's going to be more or less the same. They might put you up in a gynae setup, so they've got a bit better access. They might just do you with lying back on the bed. With guys really sort of thing, there's no reason why they can't do you lying back or sitting back on the bed. There was no need for stirrups or all the kind of crap you'd have in theatre sort of thing. Now everything's easily accessible. The room was locked, so nobody was going to walk in on us. And no, so the nurses they do this day in, day out. They're not A&E nurses or neurology, neuro nurses or whatever sort of thing. This is all they do day in, day out, and they're all good as gold. They should be anyway. As far as, we had a bit of a chat about things and how I was sort of thing, and it was what I would call pleasant experience really. At the end of the day, it's just going to be a waiting game now to see if they make any benefit. All right, guys, catch you again. Cheers and bye.